What is the health literacy gap in lymphoma awareness campaigns? Imagine trying to understand a complex map without clear labels or guidance. That's similar to what many patients face with lymphoma information. The health literacy gap in lymphoma awareness campaigns refers to the disconnect between the complicated medical details about lymphoma and what patients and the public can actually understand and use. This gap can make it harder for people to make informed choices about their health and treatment. Many patients do not feel fully informed about their lymphoma diagnosis. Studies show that only about 18% of patients feel very well informed about their disease stages and what to expect. Around 40% report that their doctors did not explain test results or diagnostic details clearly. Even more concerning, only about 2/3 of patients are told their specific lymphoma subtype, even though lymphoma has over 80 different types. This shows that vital information often isn't communicated in a way that patients can easily grasp. The understanding of lymphoma varies depending on where people live and their background. For example, in South America, nearly 78% of patients say their doctors explain their care clearly. But in the Asia-Pacific region, only about 53% feel the same way. Vulnerable groups, such as those with lower income or education levels, and minority populations, often face bigger hurdles in accessing and understanding lymphoma information. This creates disparities in health knowledge and care. Medical language used in campaigns and healthcare settings can be very technical. Terms like B-cell lymphoma or staging might be familiar to specialists but confusing to many patients. Healthcare providers need to check if patients understand what is being explained to ensure they can participate actively in decisions about their care. When patients don't fully understand their condition or treatment options, it can lead to mistakes, such as misusing medications or missing appointments. This can worsen health outcomes and deepen inequalities, as those with lower health literacy often have more unmet healthcare needs and struggle to navigate complex health systems. The problem isn't only about individual knowledge. Healthcare systems also play a role. Systems that communicate clearly, use culturally sensitive materials, and support patients in understanding their health can help close this literacy gap. Many organizations are working on policies to improve how information is shared and to make healthcare more accessible for everyone. To help bridge this gap, awareness campaigns should use simple, plain language that's easy to understand. Materials should be culturally appropriate and available in multiple languages. Healthcare professionals need training to communicate clearly and to verify that patients understand what's being said. Tools like literacy assessments can identify where patients need extra support. Empowering patients through shared decision-making and providing easy-to-access educational resources are also key steps. Addressing barriers like language differences, stigma, and socioeconomic challenges through community outreach and support services can make a big difference. In summary, the health literacy gap in lymphoma awareness is about the difference between the complex medical facts and what patients can understand and act on. Closing this gap requires efforts from both healthcare providers and organizations to improve communication, education, and system support. Doing so can lead to better understanding, more effective care, and improved outcomes for everyone affected by lymphoma. Always remember, for personalized advice, it's best to consult with healthcare professionals who can tailor information to individual needs.